Good afternoon and welcome to our Glyssa Masterclass regarding infection prevention and control PPE. Thanks for joining us and do bear with us. This is the first big masterclass that we've done in this way. I'm really excited about today because I know that we've received a lot of questions recently about the safe use of PPE or personal protective equipment. I'm especially excited today because we have someone with us called Professor Jennie Wilson, and we'll allow her to introduce herself, but we are really grateful that she was able to come and join us at the Trust and help answer all of your questions and our questions as well. You may hear another voice in the background, and that will be Paul, who's helping us, and he will be comparing this afternoon, but over to Jennie.
Okay, well, a pleasure to be here, and thank you, Lorraine. And I've worked in the field of infection control for about 35 years now, and I have to say, although this has elements of the HIV epidemic in the early 1990s, I think it's a totally unprecedented situation. I think infection control are under huge pressure, as indeed are all clinical staff. But I think we need to work together to get through this. I hope that I can help answer some questions. I have to say, often there isn't a completely right or wrong answer to any of these questions. I think for many of them, we're feeling our way, and the situation may change as we go along, as we learn more about this virus. I represent the Infection Prevention Society, which is a society that most infection control practitioners in the UK belong to, and we try and provide information and support to our members. And I've been trying to do some of that over the last 2 or 3 weeks, just looking at the background information and research evidence to try and provide good and consistent advice for our members.
Thank you. So we have around 25 minutes for you to pose your questions. Please do pose questions and we will try and answer them as they come up.
Great. So we have one question that we can kick things off with. Straight into PPE, the whole topic of PPE. Do you think the current PPE advice is safe to protect us on the front line?
Okay. So what we know about this virus at the moment comes from really two main sources of information. First of all, that it's a coronavirus, and it's very similar to a virus called SARS that caused major outbreaks in the early 2000s, but those were predominantly confined to Southeast Asia. But they told us a lot about the route of transmission of COVID-19 because it is such a similar virus. There is also quite a lot of data that was gathered in China during their outbreaks of infection. Now, obviously, the situation is quite fluid, and there are many outbreaks now occurring in the rest of the world. So our information may change as time goes on. But the evidence from China was consistently that the transmission of this virus is predominantly through respiratory droplets. So that's droplets that are expelled when people cough or sneeze, and that the surgical type mask is intended to protect against those because it prevents them from hitting your mucous membranes. Eye protection also essential in situations where there is a risk that those respiratory droplets may hit your eyes. For the majority of situations where we're caring for patients with COVID or who we suspect may have COVID, that surgical mask will protect healthcare workers. But an additional factor is that because the respiratory droplets will contaminate the surrounding environment, then it's really important that we pay attention to hand hygiene. That's always the case with respiratory viruses. And I think what this pandemic is showing us, and you will have seen from the messaging coming out of government as well, is that we tend to forget that we generally acquire respiratory viruses through touching respiratory secretions and then touching our own eyes, nose or mouth and transferring the virus in through that route.
Okay.
Thank you.
We have a number of questions coming through across different areas. Let me just dive into some of those questions for a moment. Number of questions around what to wear. Could you just answer the question, what are your thoughts on wearing scrubs? Do we need to change into scrubs?
Yes, it's interesting about scrubs. I often think that they're a very attractive thing to wear. They're a bit like your pajamas. and it makes you feel comfortable. You're not constrained by your uniform. So I can see that people often prefer to wear scrubs, and it makes you feel generally comfortable at work. I think we need to be aware of the disadvantages of scrubs. They're very anonymous, and it means that our patients struggle to know who we are unless we have a really clear badging system. There aren't any intrinsic reasons why scrubs are better in terms of infection prevention. I think a lot of the concerns come around uniform becoming contaminated and taking it home to wash it. There is no risk in washing uniform in a home setting. You can wash your uniform in your domestic washing machine. What I often say to people is, we worry a lot about the temperature of the wash, but the more important thing is that you don't pack your clothes in, because the dilution of the water is what really decontaminates our clothes. Ideally, if you're wearing uniforms at work, it would be much better if you change out of your uniform, put it in a plastic bag, and just take it home and wash it. And try and ensure that you've got enough uniforms so that you can wash them on a daily basis. And I'm sure some of your areas have gone over to scrubs, but that is an individual local choice for a particular area, and you just need to balance the advantages and disadvantages.
Yeah, I agree. And in addition to that, I know that at the moment we are really strongly expecting that all of our staff wear their own clothes to work, and they change into their uniform. Whether your uniform is indeed scrubs on that day or the regular uniform, and then changing out of them at the end of the day. And as Jennie has said, putting them in a carrier bag and taking them home to launder. The interesting thing about scrubs is when you're in a caring environment, the scrubs themselves are not part of the PPE. So you can, if you're dealing with a situation where you actually need PPE, you can put the PPE on and take it off, and then walk about the hospital in your scrubs as you would your uniform. Because I know there have been some questions about that. Can I wear my scrubs outside of the area? Well, because we're not viewing scrubs as part of the PPE, the answer is yes, you can.
Okay, there's a couple of questions that are related to that, which I'd just like to pick up on, come through online. What should we be wearing in the community?
Okay, so the community, it's the same principle as in acute care. If you're providing direct care to the patient who you suspect or is a confirmed coronavirus COVID-19 patient, then you should wear a surgical mask, eye protection, and a plastic gown to protect the uniform from contamination in that home environment. And that is sufficient protection, and obviously along with gloves, and that should all be discarded at the end of the treatment episode for that particular patient. Okay,
thank you, Jennie. I'd like to get through the questions online, if I may, and please do vote for the questions that you most like to get answers to, because we're getting quite a lot of questions through as we speak. I'll pick up on a couple that have been highlighted so far. Can masks be reused when used in public?
Ooh, that's a tricky one. Yes. Do you want to pick that one up?
I think, are we talking about in a community setting?
It hasn't been specified. So
okay. So in terms of a clinical use, so if you are a community clinical worker, just picking up from what Jennie said, that you should use your mask in an episode of patient care. So that means that when you finished visiting your patient, that you would discard all of your PPE, including your mask, before you leave that property and go and see another patient. So we would certainly not give any recommendations in terms of using surgical masks in a public arena. I think our advice needs to be restricted to the clinical use of PPE, including surgical masks.
Yeah, and I would just add to that you must always bear in mind that PPE we see as protecting ourselves, but it doesn't do that if we contaminate it as we remove it. And it's really easy to do that. You will pick up germs on your hands with everything that you touch. And then as you remove your mask, you have to be really careful to make sure that you're not recontaminating yourself. And it's one of the reasons why it's important to change it at each episode of care, so that you're not then going around touching your face and your mask for a prolonged period.
Can I pick up, there's a couple of questions which have come through, which I think are being sparked by some of your responses, which is great. Just like to pick up on these, if I may, related to masks and what to wear. Lots of concerns about what's appropriate to wear and what's not appropriate to wear. A very specific question here: disposable surgical masks, and they reference SFM 0001. Gauge the size and the too loose. Are these safe?
Okay, I'm not. Unfortunately, I'm not au fait with all of the product and product codes. But what I would say is, it is clear that you need to wear something that's fit for purpose. So if it's something that you can tie, then obviously you need to make sure that you're tying it so it feels secure. If it's something that for you particularly, whoever's asked this question, and it's a good question to ask, if it's one that has the elastic loops behind the ears and you find that that's too loose to you, then I think it's something that you should bring up locally with whoever is managing you locally, because obviously we need to make sure that all of our staff are using PPE that's fit for purpose.
Could I then just flex a little bit into aerosol generating procedures? And it might be useful just to clarify for people what that is, what we mean by that, specifically in your answer. Some staff are asking if they should be wearing hats, for example, when caring for AGP with COVID-19 patients.
So aerosol generating procedures are procedures that involve the respiratory tract of somebody affected with COVID-19, and they involve the passage of high velocity air over the mucous membranes. And what that does is it carries with it a risk that in that air passage across the mucous membranes, that it picks up tiny, tiny particles of respiratory mucosal droplets. Now, whereas the droplets that are normally expelled from the mouth during coughing and sneezing are generally quite large. I know it doesn't feel like that because you don't feel you can see them, but we're talking microns here, so very, very tiny particles. And most of them are large enough to just simply drop to the floor. And so you can't then inhale them. When you do these aerosol generating procedures, so things like intubation, certain forms of ventilation, patients needing mechanical ventilation, tracheostomies, and there's a defined set of procedures where this is a particular risk. Those tiny, tiny droplets, we call them droplet nuclei, can be released during the aerosol generating procedure, and they may be inhaled by a healthcare worker so that the healthcare worker then gets virus deeper into their lungs. And that obviously presents a risk, increases the risk that they might develop the disease themselves. So for those types of procedures, we recommend this high filtration mask, which is the one that has to be fitted really closely to the face. And that then prevents any of those tiny little droplets being breathed in, those tiny little droplet nuclei being breathed in. The second part of the question was about hats, wasn't it? Yeah. And I know this has increasingly become a concern, but what you have to remember is breathing them in. It isn't they will eventually settle on surfaces, as indeed the droplets that are generated during the procedure will as well. So the general environment will be contaminated, but those will tend to fall to the horizontal surfaces that are there. And the droplet nuclei are not going to be a problem anywhere else. It's about breathing them in that is the problem. And there is no particular reason to think that any part of you that is exposed during that particular procedure, obviously you'd be wearing a gown, so the bulk of your uniform and your hands covered by gloves will be protected. But anything else is the amount of contamination it picks up is so insignificant and is not actually going to be able to transfer into your lungs to present a risk of infection. So that's a very long-winded way of saying, no, we wouldn't recommend the use of hair covering.
The other part to that I'd like to add is there's sort of a general principle. You need to use the PPE that you actually need to use. The more items of PPE you use, you're increasing the chance of self-contamination, and that's a really important aspect to remember.
Okay, and we have a number of questions, so I am keen to get through as many of them as we possibly can. There are some challenging questions, and we won't dodge those. So let's go into new guidance from the World Health Organization, I should say, suggests eye protection must be worn even for suspected patients, which apparently is not our guidance currently.
I'm very happy to, and thank you for that question. It's a really good question. In fact, it's very interesting that our guidance does say that. So a lot of the precautions we're talking about now are transmission-based precautions. So they're looking specifically at the mode of transmission for this particular organism. But underneath that, and something that we would always be advocating, is our standard precautions. And actually, if you look at our standard precaution policy, it does say that if there's any risk of splash, as in from the droplets, as Jennie earlier described, then you should use either a face visor or single-use goggles. So actually, we would always advocate for, whether they're positive for COVID-19 or a suspected flu patient or any of the droplet precaution patients, if there is any degree of splash risk, we would always say to use a visor or single-use goggles.
Okay.
And I think part of what that reflects is that actually, as healthcare practitioners, we've often been really reluctant to use eye protection. It's something we've known in infection control for many years, isn't it? That people are really reluctant to use it. Yeah. But all of a sudden, we're now beginning to appreciate as a healthcare workforce that we need to take protection of our eyes much more seriously, because it is a mucous membrane.
Okay, so can I just pick up on a question which seems to be coming through quite a lot? It's the question of aprons versus gowns. What about the apron provided compared to gowns? The questioner says, I know many doctors are not happy with that and comparing to WHO guidelines who suggest good gowns. And is a plastic gown, separate question, the same as an apron? They provide the same level of protection.
So I think what I mentioned at the beginning, that I have been working in infection control for many, many years. And so perhaps have a historical perspective on this that other people perhaps don't realise. But in this country, we have always used plastic aprons. Whereas in the United States, they have always used gowns. They started out with cotton gowns, and then as we've moved over to more disposable items, they tended to move into disposable gowns. So there is a huge cultural difference in healthcare provider systems in their attitude to how they protect uniforms. And so the fact that other countries' guidance may recommend the use of gowns, that's because they would recommend the use of gowns for isolation precautions, period, for contact precautions or any sort of precautions. Whereas the approach we've taken in this country, which is built on evidence, is that the part of the clothing that becomes contaminated is the front part. And actually, if you think about the way that you're caring for patients, that is the part of your uniform that becomes contaminated. And what you're really concerned about is the spray of droplets that might hit your clothing as a patient is coughing. Obviously, we need to try and adhere to cough etiquette as much as we possibly can to minimise that risk. But there are many advantages to using plastic aprons, not least because as soon as you put a gown on, then the tendency is to put that gown on and then move from patient to patient. People put gowns on and they never change their gloves. And that actually is increasing the risk of transmission of this virus between people. Yes.
Okay. A lot of questions about what to wear, what not to wear. I'd like to just pick up on one or two. Question of double gloves. Should nurses and cleaners be wearing double gloves?
No.
Okay.
Because, and I know it seems tempting to do that, but if your gloves need changing because you're moving from one procedure to the other, you change the gloves. And that is really, really important. We must always remember that this isn't just about protecting ourselves. It's about protecting our patients from cross-contamination as well.
And if I can add to that, in the team, we've done a little bit of research actually regarding glove use, really actually spurred on by your glove use papers. And what we've done is we've used the light box in a different way. So we've encouraged people to put gloves on, put the UV sensitive cream on, and then remove those gloves, and then put their hands under the light box. And it is really interesting to see the residue that we leave, and if you translate that into organisms when we remove our gloves. So if you think if you're double gloving, you would only be leaving that residue on the second pair of gloves. It is far better to remove your single pair of gloves and decontaminate your hands and wrists and forearms, whatever you need to, however far you need to. That is far safer for you in terms of self-contamination, and it is far safer for those around you as well.
Great stuff. Let's look at this question here, which says, we are getting in close contact when changing the wound dressing. Do we need to wear surgical masks in contact with every patient? You might have touched on that, but...
So this is about every patient. No, the surgical mask is relevant for patients who are suspected to have COVID or have COVID. And as Lorraine pointed out, if you are in a situation, so if you're doing a wound and you feel there is a risk of splashing through how you are managing that wound, you may be irrigating it, for example, then you would wear a mask, surgical mask for that procedure because it's part of standard precautions.
Okay. And does that hold true as a subsidiary question? Do masks need to be worn in the chamber area of RSU?
Okay, yes. So May and I visited the chamber area yesterday. And I would say for any such area, so just to describe that chamber area of RSU, there are some double doors before you enter into that chamber area. And then you have 4 rooms off of that chamber. Each of those 4 rooms have doors. Therefore, we would treat those 4 rooms as individual isolation rooms. So as you would do in any isolation room situation, you would don your PPE outside of that side room. You would go in and perform your care episode. You would doff or take off all of your PPE inside that room, except for the surgical mask or the FFP3 mask, whichever mask you're using, which can be removed as you leave, as when you exit that room. That means that chamber is not a chamber that we would expect to be contaminated grossly at all. In fact, with that virus. If you wear your PPE outside in that chamber situation, including your FFP3 mask, you will inadvertently contaminate that area, and the hard surfaces become fomites. They become areas which this virus can happily live on. It would be far better to keep that area virus-free.
Yeah, and I think this is something where you really need to think about your way that you work and to do it as efficiently as possible and to minimize the risk of contamination of every environmental area. So one of the big issues for me is that if people are moving between patient care and then computers with their PPE on, they are just going to contaminate that whole area, as Yvonne says. So Yvonne, where did that come from? Lorraine said. So it's really important that you focus the protective clothing specifically on the point at which you are entering and coming out of the room, and not include sort of general nursing stations and those sort of areas in that.
Yeah, and just to follow that guidance needs to be consistent. One of the problems with not having consistent guidance in that area is that some people will treat that area as an area that they can safely use the items that are around without worrying about decontaminating their hands, whereas other people are using it for other purposes. And we need to think about our workers in this situation as well.
We've had a question that arose from one of your answers, Lorraine. I think RSU chambers again. Staff noted that the rooms got negative pressure. Would this affect the viral load travelling through doors or through the chamber?
Okay, so we've had some discussions sort of internally about negative versus positive pressure. We have 3 rooms in the trust that we can turn from negative to positive pressure. The rest of and I'm no engineer, I'm no expert, but from the little physics that I know, the rest of our rooms would mean that you have the same pressure inside the room as you would outside of the room, or else we'd have some, vacuum problems. That means, particularly with RSU, there is no negative or positive pressure in relationship in the rooms in relationship to the chamber. So if you open the door, there is no rush of air from that room because there isn't positive pressure in that room. So it wouldn't rush out of that room into the chamber because there is no vacuum.
And can I just add to that the main purpose of a negative ventilation room is to ensure that you exchange the air frequently. But actually, in an ordinary ventilated room, any room, the room that we're in now, the air changes just passively about once every few minutes. So you in a negative ventilation room, you would have air changes of about 12 an hour, wouldn't you? Yeah. Whereas in this sort of room, you'd have about 5 changes an hour. Yeah. So, and the other important thing to remember is that really the problem comes when you're doing aerosol generating procedures. So that's the time when you need to be more concerned about the air changes and good ventilation. And so those rooms where aerosol generated procedures are occurring would be important to try and keep as good ventilation as you can. The reason being that then dilutes out any of those little droplet nuclei that we have that concern about.
And just to reassure you, one of the things that's been looked at by our estates department, actually has already been looked at, is what the ventilation situation is in the entire trust, actually, and in the rooms that we're using.
Okay, I'm conscious of time. We've got a couple of questions which are quite general, or specific questions, I should say, and we come to a sort of general answer at the end. If we just quickly, short answers to these, if we may.
We don't do short answers.
Great answers, so they are. Short answers, if you may. When you're wearing a hood, should you change the filter after 8 hours or every patient?
Okay, so no and no.
Great stuff. Thank you for that answer.
So, okay, just to expand on that a little. The filters themselves has a mechanism that they will beep when the filter itself needs changing. So it's a sophisticated piece of equipment. So it is safe to use for many, many hours after many, many patients. And that's how it's been designed to work.
We had a cheeky extra question on that subject that's just come through, so I'll ask it quickly. Are surgical fluid resistant masks recommended when staff can't maintain social distancing together?
No, they're not. No, they're not. Surgical masks are not a mechanism for social distance. So for social distancing. Okay, great stuff. And there's a community-related question I'd just like to ask. I work in the community and going in and out of people's houses. We can't do this with the clothes that we wear during the day. This is a worry for us. So I suppose it's more a general statement than a comment. So that's true, but it's exactly the same for any staff working in a clinical area. They are going from patient to patient with the same uniform on, and they are protecting it with a plastic apron. So the same principle applies to going into people's home. Absolutely. Okay, and I'd just like to ask any closing comments from either of you before we close the session today. Any advice or guidance or general observations that you'd like to share? I would just say, be really, really careful to remember that it's your hands that you are likely to transfer virus to your mucous membrane. So don't think just because you've got gloves on and perhaps a gown as well or eye protection that you are protected. You always must remember that your hands are really important and that you must change your gloves. And as Lorraine kindly pointed out, wash your hands really carefully once you've removed them. I think my parting message is that we are really all in this together. And as Jennie said, that this is unprecedented. None of us have been through this before, and we will work through this together. I would just call for us in that vein to remember that the trust, as a trust, we want everybody to be safe. We want the staff to be safe. We want the patients to be safe. This is a pandemic. This means that the PPE that we require are required by absolutely every country in the world, and we all need the same limited resource. That does not by any stretch of the imagination mean that we want to put, or we are going to put, or we will put our staff at risk. Any of the recommendations that we give are not based on the amount of PPE that's out there. It is based on evidence and what will actually keep you safe. And I just want to remind you of that. Okay, I'd like to thank Lorraine and Jennie for your time. That's the end of the session. So thank you very much for joining and for tuning in. And we'll be repeating this type of session in the future, I'm sure. So thank you very much.